everyone, thanks for tuning into our channel. I'm Sandra.
And I'm Gina.
And today we're going to be going over what it's like to get Invisalign in our office.
So at your start appointment, the first thing that we're going to do is take records. So we're going to take some photos of your teeth. We're going to take a scan of your teeth because there are no impressions when we do Invisalign.
Mm-hmm.
And then
we'll also take your x-rays. And the best part about the iTero scanner is that, as Gina mentioned, there's no impressions. It's quick, it's easy, there's no mess involved. Digital little camera takes a bunch of pictures of your teeth, and all of your records will get sent off to Invisalign. That's when Dr. Boral works with their labs. And in about 2 or 3 weeks, that's when we get your aligners back.
when you do come into our office, the first thing that we're going to have you do is read over our cooperation sheet directly from our office and read over the consent form that Invisalign has you sign as well. The next part of the process is bonding the attachments onto your teeth if needed.
And they're actually tooth colored, so you don't even really see them. And everyone has different attachments on their teeth just based on the movement that's needed. It also helps the aligner to grab on a little bit more easily. They come in different shapes and sizes, and you won't necessarily have the same attachments each time that you come in for a new set. When we bond the attachments on your teeth, we will prepare the teeth using an etching gel. After that, we will use sealant, and then we will place the attachments into the attachment template that goes on your teeth, and we light them with a bonding light, and that is how the attachments stay onto your teeth. And also during that visit, if need be, we will bond buttons if necessary, and those would be for rubber bands. But again, we would go over that during your visit.
So after bonding your attachments, they're going to feel a little scratchy at first, but just remember that throughout the week when you're taking your aligner in and out, they're going to smoothen down.
And remember also, most of the time you're going to have your aligners covering them anyway.
Now, if an attachment does come off at home, you don't have to worry about it. We can rebond it on your next visit, and the doctor will also determine if you need to keep it or if it's okay to leave it off.
Yeah, that's one of the really big benefits of having Invisalign, is that it's not like braces, whereas if a brace comes off, you'd have to come in right away as soon as you can. It could be very irritating, but with the attachments, if an attachment happens to come off, you can still continue to wear the aligners as normal, and then, like Gina said, we'll just bond them back on, at your next appointment. No big deal.
After the attachments are bonded on, we are going to show you your set of aligners. Everyone has a different number of aligners in their box, and each of them are for the week you're going to change them.
So they'll look something like this. So not only are the pouches in the box labeled, the aligners themselves are actually labeled as well on the underside of the aligners. Now, it is very important that you know how to properly place and remove your aligners. It's going to help the aligners to not break. It's also going to help the attachments not break off your teeth. If you are placing them in or taking them out the wrong way, again, you can break an aligner in half, or an attachment can come off. So when placing your aligners in, all you need to do is really just match up the front teeth to the front of the aligners, just like as if you were matching up a piece of a puzzle. So you just want to match them up, and all you need to do is just use gentle finger pressure to place them onto your teeth. You never want to bite them into place because they are plastic, so you do not want them to crack, or certainly we do not want them to break.
So when taking out your aligners, we always want to start from back to front, and we also want to start from the inside. So you start in your back molars, and you just gently lift up on one end, and then you're going to lift up on the other end, and then they should come off pretty easily. If you have more attachments, it's a little harder. Just keep working your way forward, and eventually they should come out. How long are we wearing our aligners for, Sandra?
Oh, that's a good question. So, normally, you would wear your aligners, as we recommend, for about 21 to 22 hours a day. And the only time you're taking them out is when you're eating breakfast, lunch, dinner, having a snack, or if you're drinking anything other than cold water. So if you're just drinking water, that's a big plus. You could just leave them in.
Also, there are no food restrictions with Invisalign, which is a huge plus. With braces, you can have hard, sticky, chewy foods, candy. With Invisalign, you could have it all.
With eating your meals, don't feel like you have to take your aligners out. Oh my god, I gotta eat all my food all at once and then put them back in. You can take your time, it's okay. Just make sure before you put them back in, you want to make sure that you brush your teeth, brush your aligners, and pop them back in. And if you can't brush your teeth, at least try to rinse out with some water just to get any food debris out, and then when you get the chance to brush your teeth, you can brush your teeth afterwards.
Now also, if you are out to dinner or you're out for the day and you've had your aligners out for a very long time, we recommend that you just add an extra day to your week. Just make up those hours.
So for example, if you change your aligners every Friday, if you're changing weekly, and you leave them out for 5 hours or 6 hours because you don't want to constantly be taking them out, it's okay, don't worry about it. Instead of changing every Friday, just add that extra day and change on Saturdays instead.
So another important thing is whenever your aligners are out, always put them in your case. We've had plenty of instances where you put it in a napkin and it's thrown away. Also, we've had patients with some pets that like to play with them, so always put them right in your case after they are off your teeth.
And small children, sometimes they'll think it's a toy, so always keep them in their case.
Depending on the amount of aligners that you have, Dr. Boral will also determine if you're going to change them weekly or bi-weekly.
So once you are ready to change into your next aligner, whether that be in a week or 2 weeks, you don't want to throw your aligners away. You want to brush them, clean them, rinse them off, and dry them. And you want to put them back in their little pouch. So you see here we have a little baggie here, and it's kind of got the little zipper thing going on. So you would take your aligner that you just finished wearing, you would pop them back into the bag, and then you would change into your next aligner. So you would just open up the next one and then start wearing that one. And the reason why we want you to save your aligners is if you notice that something is not right, it's not fitting, something feels a little bit strange, go back to the one that you just had in, give us a phone call, and bring the whole box of aligners with you, because we can always go back to a previous aligner to see which one fits best.
So if you break or lose an aligner, you could always move forward to the next week. It might feel a little sore because your teeth aren't ready for it.
So you just want to make up that time just because you are changing them a little bit earlier. They might not fit correctly, so you just want to make up for that little bit of time that you lost with that aligner.
And you'll also notice that your teeth aren't ready for the next aligner if you're not tracking, which means the aligner and the bottom of your teeth aren't meeting. So if you can see the first one, you'll have very minimal space because of the thickness of the material. But if you see a huge space between your teeth and the aligners, that means that you're either not wearing them the full 22 hours a day that you should be wearing them, your teeth aren't ready for the next aligner.
Of course, if you notice anything like this happening, you would want to call us and come in, bring your box, just to see if we can fix the issue before it gets any worse. And as a last resort, we would just take another scan for you and get aligners that fit. Sometimes to aid with tracking in your aligners, we will provide you with something called a chewie. And it looks like this. It's a little rubber piece that you would use to kind of help to seat the aligner a little bit better. So you would use this twice a day for about 15 to 20 minutes each time. And of course, as instructed by Dr. Boral or by your doctor, you would chew on it on whatever teeth you would need. So if I needed to use it on my cuspid, I would place it there and I would bite down onto it for about 15 to 20 seconds or so, and then move on to the next one. And you would do it in the morning and at night for about 15 to 20 minutes, and it just helps to seat the aligner up a little bit better wherever you might need it. Sometimes during your treatment, we may need to do something in which we call IPR, that is interproximal reduction. Sometimes teeth are very crowded and they don't really have anywhere to go. So what we would do is that the doctor would take a small little file about the width of a dental floss and just slightly file in between those teeth that need it. It's not going to cause a huge gap or anything like that. It doesn't do any damage to the enamel. It is completely normal. It's just going to help us to give a little bit of space for those teeth to go somewhere, because if we don't do that,
They're never going to go anywhere.
they're not going to go anywhere. So it is an integral part of some patients' treatment. The first set of aligners that you get is not always necessarily your last set of aligners that you're going to get. So depending on the treatment and what you need, you can have 10 aligners, you can have 40 aligners. It all just depends on what your mouth needs. So just when you are done with that first set doesn't mean you are completely done with treatment. Once you are almost done at the end of your first set, you will come in, we will evaluate everything, and then we'll take some progress pictures, we'll do an additional scan, just for any little refinements that Dr. Boral may need to do. So to keep track of your aligner changes, you could either mark it down on your calendar, mark it in your phone, in a planner, whatever you prefer to do. But Invisalign actually does have an app. So you would just scan this QR code with your phone. It'll take you to the App Store or the Google Play Store. And then it'll ask you for your patient information. So you can either fill it out, or it will ask you for your patient number. And that will actually be provided for you on your little baggie. So here's an example. You'll see the little patient number there. You would put that in. So you would put in your information, and then you will actually get notifications sent to your phone about when to change your aligners. And you also get to take some progress pictures. The app also has a timer if you would like to use, just so that you can keep track of how long you do have your aligners out for the day.
The next thing we want you to know is how to take care of your aligners. So a toothbrush and toothpaste is always the best bet because it really gets in there and takes out whatever plaque is left over or any food debris that's left over in the aligners. So we don't recommend you leaving them in any type of mouthwash, whether it's a clear mouthwash, a colored mouthwash. We just don't want you to use that because it could make them cloudy or even tint them a color you don't want them to be. So in our office, after we are done providing you all the instructions for your Invisalign, we'd like to give you a little goodie bag with very important things inside. So the first important thing is your Invisalign case for your aligners. So it's easy if you want to put it in your pocket, in your pocketbook. It's not clunky and chunky.
And it's magnetic.
We have some candy because remember, you have no food restrictions. We also provide you with a toothpaste. And we have a nice toothbrush in your bag.
So when you start Invisalign treatment at our office, what we like to do with our patients is that you become a member of the Invisalign Club. Something fun we like to do.
So with every visit, you will get a signature or a stamp, and on the fourth stamp, you get to spin the wheel, which you're always guaranteed a prize.
We've got Target gift cards, Starbucks, movie tickets, McDonald's. You know what? It's changing every time, so you're always guaranteed to win a prize.
Yes. We also love to provide a little gift for our patients. It's a nice t-shirt. In this case, we have a nice blue tie-dye one. So towards the end of the treatment, you will start your retention phase, which you're wearing your aligners for a minimum 12 hours. So sometimes you'll have passive aligners towards the end of your treatment, which you would use as retainers.
And you're not changing those every week or every 2 weeks like you normally would with aligners. Those you're going to keep pretty much for as long as you can and as long as you take care of them, of course. So the benefit to having those passive aligners is that you don't just have one retainer, you do have maybe 2 or 3. Also, if you would like to go the Vivera route, those are actually the Invisalign brand of retainers. And we actually do have a video about our Vivera retainers. So if you want to watch our Vivera video, you can actually click on the link below or the little info card right up here. To be sure that you are going through your treatment successfully and safely, of course, you want to be sure to remember to wear your aligners for the time instructed by Dr. Boral or by your doctor. I know there's a lot of things on the internet that some people will say that they change their aligners every 5 days because they feel like their teeth are ready for it. Follow your doctor's instructions. You want to be sure that you are going through your treatment the correct way, and you want to be sure that you are safe because you do not want to do any damage to your teeth. So just like with anything else, Invisalign will become part of your daily routine. So if you're a little bit worried about the responsibility of wearing Invisalign, just remember it's just like anything else. You will get used to it. Definitely recommend the Invisalign. Again, there's no poking wires, no brackets, no super emergency visits. So those are just some of the great benefits of having Invisalign versus having braces. And I don't know if any of you could tell, I'm wearing Invisalign right now.
With all the information that we did give you for your new Invisalign, if you still have any questions or if you don't feel comfortable with certain things, always give our office a call and we'll be more than happy to help you out.
So we hope that we gave you enough information to give you the confidence to start your Invisalign treatment. Again, like Gina mentioned, any questions, call the office, ask any questions in the comments down below, and we hope that we can help you. And we are so excited if you decide to start Invisalign to start your journey to a new smile. So thanks for watching, and we'll see you next time.
Adios.